not forget. Mersey syndrome is a nightmare for surgeons, laparoscopic surgeons. So this type of issues we are not encountering now. I'll tell you very simple. We are not encountering the issues of anomaly of cystic duct, anomaly of common hepatic duct, anomaly of Mersey syndrome. Nothing we are encountering in today's practice. The reason is very simple, because we never do laparoscopic cholecystectomy without having an MRCP picture. Please remember, just 4,500 rupees. It's not going to be a major expenditure on the patient. MRCP, actually, as per protocol, as per books, it is not always needed. But if you start doing MRCP for all laparoscopic cholecystectomy, you have a roadmap. You know where is the cystic duct inserting, where is the gallbladder seen. So roadmap is obtained with the help of MRCP. I will request all surgeons. Please do MRCP before doing, even it is a simple cholecystectomy. You think it is a simple cholecystectomy also, please have MRCP and get a reconstructed image. Get a reconstructed image of MRCP. That is most important before going for a surgery. I'll show you. This image I'm going to show you is for final MBBS students. Those who are attending the class here. You should not forget what is MRCP image. You should never forget what is MRCP image. There's a picture showing you an MRCP, clear-cut MRCP picture. So this is a picture of MRCP. So in this patient, if you see, you can see there is a picture showing you gallbladder. You can see where is the cystic duct going, and you can see in this picture there is a stone in the bile duct. Everything you can get in MRCP before entering into the field. Before entering into the field, you have a clear-cut anatomy of entire system. So I will tell you, MRCP should be made as a protocol before doing laparoscopic cholecystectomy. Just a simple expenditure, but definitely it is going to save the life of the surgeon, not the patient. It is going to save the life of surgeon. So I started taking MRCP for all patients before doing a laparoscopic cholecystectomy. In fact, I will even reduce my fees if the patient comes with the MRCP picture. So MRCP is going to save the life of the patient as well as the surgeon. So please advise MRCP before going for a laparoscopic simple cholecystectomy. For MCQ point of view, when will you advise MRCP? This is for PG aspirants. When will I advise indications of MRCP? Indications of MRCP in a protocol. As per protocol, when the patient is jaundiced, when a cholecystitis patient is jaundiced, you have to do MRCP to look for CBD stone. When the patient is not jaundiced, when the patient is having alkaline phosphatase elevated alkaline phosphatase is an indication of there is a stone or some obstruction. So when there is alkaline phosphatase elevated, I will do a MRCP. Number 2. Number 3, when the CBD is dilated more than 6 millimeters. When the CBD is more than 6 millimeters. So patient jaundiced or serum bilirubin is elevated, alkaline phosphatase is an elevated, CBD diameter more than 6 millimeters. These are the actual indications of MRCP. So to be practical, if you have a good setup means what? If I have a on-table intraoperative cholangiogram, if I have a facilities of on-table intra-op cholangiogram. What is intra-op cholangiogram is beyond the scope of this chapter, but I will tell you, I have never done this intra-op cholangiogram because I don't have this facility, but many institutes, they have an intra-op cholangiogram facility. Before cutting the cystic duct, during laparoscopic cholecystectomy, before cutting the cystic duct, they will cannulate the cystic duct with a small cannula and push the contrast and see for any leak from the CBD or any stone in the CBD. They will see during surgery itself, they will see for any leak or any stone in the CBD. This is known as intra-op cholangiogram. If you have this facility, you can proceed without even MRCP. But the point is, there is a straightforward line in Bloomgart. The role of intra-op cholangiogram has come down nowadays, has decreased because of MRCP being there in the hand before surgery, because of MRCP. So MRCP is a non-invasive investigation. It is a simple investigation unless the patient is not having any claustrophobia or MRI contraindications. If you do MRCP, there is no role of intra-op cholangiogram unless you suspect any bile duct injury during surgery. So intra-op cholangiogram I have not done, we have done more than hundreds of cholecystectomy in the past 5 years, but we have never done a intra cholangiogram. But 90% of the patients, I ask them to come with MRCP report. Only with the MRCP report, I will proceed with the surgery. So this is very important. On table intra cholangiogram, please don't forget, it is getting slowly decreased because of the MRCP.